Hi, I'm Dr. Stephen Stokes. Welcome to the channel. I'd like to talk about prostate health a little bit if I can, and it's very important. I'm a middle-aged man, and I have a prostate. I'm an owner, as they say, so I feel qualified to speak about it. A lot of men don't know what the prostate is. They don't understand how the health of the prostate is a foundational marker for the health of the whole system, right? And I want to get into this today. Short video, but an important video. If you're a young man, a middle-aged man, or if you're an older man, like my father, who turns 81 this month of May, then you need to understand your prostate and you need to keep it healthy. And today I want to talk about what the prostate does. I want to talk about how you can test it very non-invasively, right? This is not a invasive prostate test that we're talking about, an easy way to check your prostate health. And also I want to talk about a non-hormonal, natural, plant-based approach to helping the prostate if it's unhealthy or maintaining the health of the prostate if it's already healthy. So join me and let's talk about the prostate. First, it's about the size of a walnut, this prostate, and it sits below the bladder and it wraps itself around something called the urethra. Now the urethra is the tube that you use to urinate out of, okay? But you can also use that to also bring semen out of your body, right? And the prostate provides a fluid for the semen to travel in, and also in that fluid it gives it a lot of nutrition. But another important thing that the prostate does is it acts as a facilitation switch between ejaculation and urination. I think that's incredible. So it actually changes its function to allow for one or the other processes to occur. This, by the way, is a bowl of pumpkin seeds on my desk. More on that later. So that tube is surrounded by the prostate. It wraps right around it. And so right away you can see the potential for a problem. If that prostate gets large, if it grows a little bit, then it can be like stepping on a garden hose and it can cause problems to that tube, that urethra tube. And that's in fact what happens with a very common condition called benign prostate hypertrophy. It's very common in men over 50. Now this is a benign disorder, okay? So this is not like prostate cancer. It's benign, and it's really a side effect of not being healthy. So if you have BPH, then I don't want you to think of it like you've got this horrible disease. I want you to think of it like simply you're not healthy, and the goal is to get healthy. When you get healthy, you can reverse BPH quite easily. One thing great about the prostate, in my clinical experience, is that it responds very, very well to this type of plant-based therapy. And so if you're wanting to keep it healthy, or if you want to get it healthy because it's not, then this is really going to be a solution for you. A lot of men come to my clinic with prostate issues. They're not aware that it's the prostate. Some of the things that they say to me is they say, look, I'm getting up in the middle of the night, right? Several times to go pee. Or they'll say that when they do pee, they feel like after they empty their bladder that there's more to go, that they're not fully emptying their bladder. Or they'll tell me that when they do urinate, it's a very mild stream, right? It's not like what we used to say when we were kids, he is urinating like a racehorse, right? Well, you're certainly not going to get that if you've got this enlarged prostate. It's going to be more of a dribble. And men notice that. They don't understand it. And they mention it to me. And the first thing I do is I say, you could have a prostate problem. Let's get a PSA test. Prostate-specific antigen is what PSA stands for. This is a chemical that is released by the prostate into the bloodstream. If that chemical is released in high amounts, it could be a sign that either you have a prostate infection, or you have an enlarged prostate, or hopefully not, you have prostate cancer. So we don't really know what you have at that stage, and then we'll go and do more testing. But we do the PSA test because it's non-invasive blood test. If that is a normal test, if then those numbers come back good, that's a very good sign, right? One of the things, though, that I found in the last 20-odd years of doing this is that about 30% of those PSA tests are not accurate. Those numbers become high, artificially high. If you're going to go and get a PSA test, first and foremost, don't exercise 24 hours before you go get the test. Extreme exercise can cause your prostate to release more PSA into the bloodstream. So we don't want that. We'll get a false positive. Also, don't ejaculate. Yeah, I said it. don't ejaculate before you go for your prostate test. Ejaculation causes the prostate to release high amounts of PSA into the bloodstream. So we don't want to do that. Wait 24 hours, right? Be a monk for 24 hours before you get your PSA test. And the other thing is inflammation, right? So if you're under extreme amount of stress, or if you have infection, that can also increase PSA. And these things can all create numbers that are very high, and they can cause false alarms. And we don't want to see that. So take care of yourself 24 hours before you go get your PSA test. That is my advice. Now, what can we do to keep the prostate healthy? Very simple. There's just one product that I recommend, because that one product has everything you need for a healthy prostate. And it's not inexpensive, but when you know what's in there and you realize you're covering all the bases, it certainly has a lot of value. This product is called Prostaco, and Prostaco is made by Mediherb. And what it has a couple of different herbs in the capsule. First, it has saw palmetto. Saw palmetto suppresses a hormone called DHT. DHT is like fuel, right? It's like gasoline to fire when it comes to growing the prostate. We don't want that. The saw palmetto is going to shrink the size of the prostate if it's already enlarged. It's going to keep it normal size if it's potentially going to get larger. So the saw palmetto is an essential part of the mixture. Secondly, we have nettle root. And nettle root is the herb to support healthy urinary flow. So remember, we talked about men having trouble with a good stream. Nettle root is going to, it's going to make that racehorse performance of urination that we all want so badly. So nettle root is good for that. And finally, it has this bark. This is an amazing product. It's called Crotava bark. Now, first of all, Crotava bark is used. It's been used for a long time in traditional Indian medicine for a lot of different things. But what Crotava bark does, in my opinion, more than anything else, is it supports bladder tone. So this is going to tone your bladder, strengthen the bladder, strengthen and tone the actual cells that make up the bladder walls. And this is going to give you a lot of relief from, having to get up and go to the bathroom all night long. It's going to end that war for you. And so, again, these three products, saw palmetto, nettle root, and the Crotava bark, it's a trifecta for your prostate. And by the way, they take these herbs and they put them in a liquid base, and that liquid base is pumpkin seed oil. Now, why is pumpkin seed oil so great for the prostate? It's because of the zinc and the fatty acids. So the prostate loves zinc and it loves fatty acids. And by putting those herbs in a zinc fatty acid base, we cover everything. So this is going to support the health of the prostate. It's going to promote the longevity of the prostate, and it's going to help reverse illness if you're suffering from a prostate condition currently. If you're interested in this product, you can use the link in the video. You can take a picture of the QR code that's on the screen now. And you can get more information on my website. And if you buy it from the links provided, you're buying directly from Standard Process, you're getting any discounts that they offer, you're helping support my efforts here with this channel. And I would advise you also to take a look at me on my website, drstevenstokes.com. You can download free copies of my books, and you can converse with me directly. I don't charge for consultations. My cell phone is listed there. Happy to talk to you. If I can help, it's my pleasure. Hope this was helpful, guys. Please subscribe to the channel. Let me know what you think in the comments, and I'll talk again soon. Bye-bye.